Dorothy is 74 years old. She is a retired school teacher from Lancaster, Pennsylvania, and for 11 years she has swallowed the same 2 pills with her morning coffee, 1 purple capsule for heartburn and 1 small white tablet for her blood pressure. She refilled them on time. She never missed a dose, and on a Tuesday morning this past March, while she was standing at her kitchen sink rinsing a coffee cup, her heart began to flutter in her chest like a bird trying to get out. Her daughter drove her to the emergency room in Lancaster, where a monitor showed her heart skipping and stumbling through an irregular rhythm, and where a lab result came back that stopped the attending physician mid-sentence. Dorothy's magnesium was drained. Not a little low, drained. And here is the part that matters for you. Neither of Dorothy's pills was defective, neither was counterfeit, neither had been recalled. Both pills were doing exactly what they were designed to do, and doing it so well that for 11 quiet years, month after month, they had been pulling magnesium out of her body faster than her breakfast could put it back in. Nobody warned her, not the label, not the pharmacy printout she threw away with the bag. Not the 15-minute appointment where the prescription got renewed with 2 clicks. In the next 25 minutes, I am going to walk you through the 9 everyday pills that can quietly drain magnesium from your body, and several of them are sitting in American medicine cabinets right now, including at least 1 you can buy without a prescription at any grocery store. I will show you the 3 early warning signs that show up weeks or months before anything lands in an emergency room. I will explain why the standard blood test can come back looking perfectly normal while this is happening, which is the single most important thing in this entire video. And I will give you the exact questions to bring to your doctor and your pharmacist, because the answer here is never to stop a pill on your own. There is also one specific 2-pill combination, a combination millions of older Americans take every single morning that drains magnesium faster than either pill alone. Dorothy was taking it. I will name it later in this video because the way it sneaks onto a medication list is exactly the way it may have snuck onto yours. Before we go further, one thing needs to be said plainly. This video is educational. It is not medical advice, and I am not your doctor. Nothing you hear today is a reason to stop or change any prescription. It is a reason to have a better conversation with the people who prescribe for you. Now, here is exactly what you are getting in this video. First, all 9 pills by name, including which ones are prescription and which one is sitting on an open shelf between the aspirin and the antacids. Second, the 3 early warning signs of a magnesium drain, and why the one that happens at 2 in the morning is the one most people dismiss for years. Third, the reason a normal magnesium blood test can be dangerously misleading, which comes down to where in your body magnesium actually lives, and it is not in your bloodstream. Fourth, the 2-pill combination that compounds the drain, the one Dorothy was on, and how to spot it on your own pill organizer in under a minute. And fifth, the specific word-for-word questions to ask at your next appointment, plus the one free resource most Medicare drug plans already offer that almost nobody uses. Every one of those 5 gets paid off before this video ends, in that order. A quick word about who is talking to you. My work is medication safety education for older adults. I spend my weeks reading the drug research, the government drug information pages, and the studies that never make it into a 15-minute appointment, and I translate them for people over 60, because you are the group taking the most pills with the least explanation. While you are here, do me a favor. Drop your age in the comments and tell me how many prescriptions you take every day. It helps me make these videos for the people actually watching them. Let's go back to Dorothy because her story is the pattern, and I want you to see the whole thing. Dorothy started omeprazole in 2014. Heartburn after dinner, a few bad nights, a quick appointment, and a prescription that eventually became an over-the-counter habit. It worked beautifully. Her heartburn essentially disappeared, so she kept taking it, the way you keep taking anything that works. 2 years later, in 2016, her blood pressure crept up, the way it does for most Americans in their late 60s, and her doctor added hydrochlorothiazide, a water pill, one of the most commonly prescribed blood pressure medications in the United States. It also worked. Her numbers came down. 2 pills, 2 successes, and a medication list that nobody ever looked at as a whole. Around 2021, Dorothy started getting leg cramps at night. Charley horses that grabbed her calf at 2 in the morning and left it sore until lunch. She mentioned it once at an appointment. She was told it was common at her age. Drink more water, maybe eat a banana. Then came the fatigue. Not sleepiness, a heaviness, like her arms and legs were filled with wet sand. She blamed her age for that, too. Then, in the winter before her emergency room visit, an occasional flutter in her chest, a skipped beat here and there, gone before she could even describe it. Each symptom on its own looked like nothing. Each one got explained away. What nobody did in 11 years was put the 3 symptoms next to the 2 pills and ask one question. What do both of these medications do to magnesium? Because the answer was sitting in plain sight. The omeprazole was reducing how much magnesium her gut could absorb from food. The hydrochlorothiazide was increasing how much magnesium her kidneys flushed out in her urine. Less coming in the front door, more going out the back door, every single day for years. Her body compensated as long as it could, pulling magnesium from its reserves, until one Tuesday in March there was not enough left to keep her heart's electrical rhythm steady. And here is what nobody told her, the sentence I want you to remember from this entire video. Dorothy is not a rare case. Dorothy is what this looks like when it works exactly as the pharmacology predicts. If you are over 60 and taking even one of the 9 pills I am about to walk through, some version of Dorothy's arithmetic may be running quietly in your body right now. To understand why, you need about 3 minutes on what magnesium actually does, because most people file it next to the gummy vitamins, and that is a serious mistake. Magnesium is what the National Library of Medicine classifies as an essential macro mineral, and its Medline Plus resources on fluid and electrolyte balance explain that electrolytes like magnesium are what allow your muscles and nerves to work and what help keep your heart rate and heart rhythm steady. Read that again in your mind. Heart rhythm. Magnesium is part of the electrical system of your heart. It is also involved in hundreds of chemical reactions your body runs every day, in your muscles, your nerves, your bones. When it runs low, the condition is called hypomagnesemia, and the National Library of Medicine has an entire medical encyclopedia page devoted to magnesium deficiency. Because low magnesium is not a wellness buzzword. It is a recognized medical condition with recognized consequences. And the consequences are not small. A 2024 review in the journal Nutrients found that low magnesium status is associated with high blood pressure, with calcium building up in the coronary arteries, with stroke, with atrial fibrillation, with heart failure, and with cardiac death. Sit with that list for a second, because it reads like the top fears of every American over 60. There is more. A 2021 study published in the journal Hypertension, drawing on the chronic renal insufficiency cohort, examined how serum magnesium relates to blood pressure, to the risk of hypertension, and to how chronic kidney disease progresses over time. So your magnesium status is tangled up with the very conditions many of these pills are prescribed to treat. Now, the mechanism of the drain itself. There are two doors. Door 1 is absorption. Magnesium comes in through your gut, from food, and your stomach chemistry is part of how it gets absorbed. Change the chemistry of the stomach for years on end, and you can change what gets through. Door 2 is the kidneys. Your kidneys constantly filter magnesium and decide how much to keep and how much to send out in your urine. A whole family of medications reaches into that decision and tips it toward flushing. Researchers have known this for decades. A review in the journal Mineral and Electrolyte Metabolism back in 1991 documented renal magnesium wasting, meaning magnesium lost through the kidneys, caused by a range of therapeutic agents, and called it an important cause of low magnesium in hospitalized patients. That was over 30 years ago. The drugs on that list did not go away. Several of them became some of the most prescribed medications in America. And now the hidden detail, the one that answers the question you should be asking, which is, wouldn't my blood work catch this? Here is the uncomfortable truth. The overwhelming majority of the magnesium in your body is not in your blood. It lives inside your cells and inside your bones. The blood carries only a tiny fraction of it. So when your body starts running short, it can pull magnesium out of storage to keep the blood level looking acceptable. The way a family in financial trouble keeps the checking account looking normal by quietly emptying the savings account. A standard test can come back in the normal range, while your reserves are being spent down year after year. That is why Dorothy had years of blood work that never raised a flag, right up until the morning the savings ran out, which also explains why nobody caught it. The system was checking the checking account. Dorothy is one face of this. I want to show you 3 more, because this drain wears different disguises depending on which pill is doing the pulling, and I want at least one of these people to sound like you or someone at your dinner table. Frank is 68, a retired electrician outside Phoenix, Arizona. Frank has heart failure, and his cardiologist has him on furosemide, a loop diuretic, 40 milligrams every morning, to keep fluid from building up in his lungs and ankles. Furosemide is doing an important job. It may also be keeping Frank alive. But loop diuretics work by making the kidneys flush, and as a review in the American Journal of the Medical Sciences noted back in 2000, some diuretics increase the amount of magnesium leaving the body in the urine, along with other electrolytes. Frank's version of the drain showed up as weakness. He noticed he needed the handrail on his back steps, then that he needed to sit down halfway through mowing his gravel yard, then, one Saturday last fall, that his legs simply buckled getting out of his pickup truck. He did not fall onto concrete. He fell against the door. But a fall at 68 is a coin flip you do not want to keep tossing. For a man on a heart failure drug, muscle weakness and a wobbly heart rhythm are exactly the two symptoms he could least afford, and nobody had ever said the word magnesium to him. Miriam is 63, a church administrator in Macon, Georgia, and she has taken metformin for her type 2 diabetes for 9 years. Metformin is a workhorse drug, and for many people it is the right drug. But a 2025 case and narrative review in the journal Kidney Medicine documented low magnesium associated with metformin use in people with diabetes. Miriam's version of the drain hid inside her diabetes itself. She developed tingling and cramping in her feet and lower legs, and everyone, including Miriam, filed it under diabetic nerve trouble, because that is the obvious explanation for a diabetic with tingling feet. Nobody checked whether a mineral involved in nerve function was running low, because the obvious explanation was already sitting there. That is the cruelest disguise this problem wears. It hides behind the diagnosis you already have. And then there is Walter, 71, from Rochester, Minnesota. And Walter is the case that surprises people. Walter received a kidney transplant 6 years ago, and every day since, he has taken tacrolimus, the drug that stops his immune system from rejecting the kidney that saved his life. Tacrolimus is not optional for Walter. It is the deal he made to stay alive. But a 2006 report in transplantation proceedings found that among kidney transplant recipients on tacrolimus, 43% had low magnesium, with markedly increased amounts of magnesium leaving the body in the urine. 43%. Nearly half. And a 2020 study in Physiological Reports worked out part of the machinery, showing that tacrolimus induces this kidney magnesium wasting through a specific cellular mechanism. Walter's version showed up as tremor in his hands and cramps that woke him at night. And for a transplant patient, every new symptom is terrifying because the first thought is always the kidney. 3 people, 3 different pills, 3 different disguises. 1 mineral. So let's do what nobody did for Dorothy, Frank, Miriam, or Walter. Here are the 9 pills, one by one, in plain English. As you listen, I want you to actually picture your own pill organizer and count how many of these are in it. Pill number 1, omeprazole, the purple heartburn capsule, sold under brand names you know, and as a cheap store brand in every pharmacy in America. No prescription required. Omeprazole is a proton pump inhibitor. It shuts down acid production in your stomach, and the National Library of Medicine maintains a full drug information page on it, because a drug this widely used deserves one. The concern is long-term use. This class changes the stomach environment that plays a role in absorbing magnesium from food. So the drain here is at the front door, less coming in, meal after meal, year after year. The person at risk is not the one who takes it for 2 weeks of bad heartburn. It is the person who started it during the Obama administration and never stopped. Pill number 2, the rest of the proton pump inhibitor family, esomeprazole, lansoprazole, pantoprazole, the cousins of omeprazole. Different names on the box, same acid shutdown mechanism, same front door concern with long-term use. I give them their own number because people switch between them for years and tell themselves they changed medications. Chemically, you stayed at the same address. Pill number 3, furosemide, Frank's drug. The loop diuretic and its relatives like torsemide and bumetanide. These are powerful water pills used for heart failure and serious fluid retention. And the diuretic research going back to that 2000 review has noted increased magnesium loss in the urine with some diuretics. Loop diuretics are backdoor drugs. The kidneys flush, and magnesium can go with the flush. These drugs are often genuinely life-saving, which is exactly why the right response is monitoring, never quitting. Pill number 4, hydrochlorothiazide, Dorothy's second pill, along with chlorthalidone and the other thiazide-type water pills. These are among the most prescribed blood pressure medications in the entire country, often hiding inside combination pills, where the label lists 2 drugs in one tablet, so millions of people are taking a thiazide without ever hearing the word. Same backdoor concern. The kidney is nudged toward flushing, and this is where I pay off the combination I promised you at the start. A proton pump inhibitor plus a diuretic. Omeprazole plus hydrochlorothiazide. The front door narrows and the back door swings open at the same time. Less magnesium absorbed, more magnesium flushed, every single day. And both pills are so common and so commonly taken together that this pairing sits in millions of American medicine cabinets without a single conversation about what it means for magnesium. That was Dorothy's arithmetic. Check your organizer for it tonight. Pill number 5, metformin, Miriam's drug, the most common starting medication for type 2 diabetes in America. The 2025 review in Kidney Medicine documented the association with low magnesium and the population taking metformin. Older adults with diabetes is a population that can least afford it because diabetes already complicates nerves, muscles, and the heart. If you take metformin, this is not a reason to fear it. It is a reason to add one question to your next diabetes checkup, and I will give you the exact wording in a few minutes. Pill number 6, tacrolimus, Walter's drug, taken by transplant recipients and by some people with autoimmune conditions. The numbers here are the starkest in this entire video. 43% of tacrolimus-treated kidney transplant patients with low magnesium in that transplantation proceedings report, with the 2020 Physiological Report study mapping the mechanism in the kidney. If you or someone you love has had a transplant, magnesium belongs on the standing list of things the transplant team watches, and in good transplant programs it usually is. Ask anyway. Pill number 7, cyclosporin, the older sibling of tacrolimus, same drug family, the calcineurin inhibitors, used in transplant medicine and for some severe autoimmune diseases. It reaches into the same kidney machinery, and the concern travels with the family. Fewer of you are on this one, but the ones who are tend to be on it for years, and years are exactly what this problem needs. Pill number 8, aminoglycoside antibiotics, drugs like gentamicin, given mostly by IV in hospitals for serious infections. You will not find this one in your organizer, but here is why it earns its number. If you are hospitalized with a bad infection, treated with one of these, and then discharged, you can leave the hospital with your infection cured and your magnesium reserves depleted, and the cramps and fatigue that follow get blamed on the hospital stay itself. Kidney magnesium wasting from therapeutic agents is exactly what that 1991 review was cataloging in hospitalized patients. After any hospital stay involving IV antibiotics, it is fair and reasonable to ask whether your electrolytes, including magnesium, were rechecked before or after discharge. And pill number 9. Platinum-based chemotherapy drugs, most famously cisplatin, along with certain other hospital-administered agents, like the antifungal amphotericin B. These are hard drugs for hard diagnoses, and nobody chooses them casually. But they are known to be tough on the kidney's handling of magnesium, and cancer treatment at any age over 60 is grueling enough without an unrecognized mineral drain, adding cramps, exhaustion, and heart rhythm worries on top. If you are in treatment, or you were, magnesium monitoring is a completely legitimate topic for your oncology team, and the good ones are already watching it. That is the list. 9 pills, 2 doors. Count yours. Now let me keep the last big promise, the 3 warning signs and the exact questions, and then I will hand you one bonus that costs nothing. The 3 early signs, according to the pattern you have now seen 4 times in this video, and consistent with what the National Library of Medicine describes around magnesium deficiency, look like this. First, muscle cramps and twitches, especially those 2 in the morning Charlie horses that everyone waves off as just getting older. Second, fatigue and muscle weakness, the wet sand heaviness Dorothy described, the handrail Frank suddenly needed. Third, and most serious, heart rhythm disturbances, flutters, skipped beats, a pounding that comes out of nowhere and leaves the same way. Any new or worsening heart rhythm symptom deserves a call to your doctor promptly, full stop, whatever the cause turns out to be. None of these 3 proves your magnesium is low. They all have other possible causes. But if you have even one of them, and you also take pills from today's list, that combination is worth a conversation. So, here is the exact wording to bring to your next appointment. Question 1, for your doctor. Given my medication list, is there anything here known to lower magnesium, and does it make sense to check my level? Question 2, if the test comes back normal. I have read that most magnesium is stored inside cells and bone, not in the blood. So how confident can we be in this result given my medications and my symptoms? That single question tells your doctor you understand the checking account problem, and it changes the quality of the conversation instantly. Question 3, for your pharmacist, and this is the free bonus almost nobody uses. I would like a full medication review. Do I qualify for medication therapy management through my drug plan? Many Medicare drug plans offer exactly that, a free, sit-down, comprehensive review of everything you take, with a pharmacist whose entire job is to catch interactions and cumulative effects like this one. And most people who qualify never ask. One caution before anyone drives to the vitamin aisle. Do not start high-dose magnesium supplements on your own, especially if you have any kidney disease, because your kidneys are what clear magnesium, and supplementing with weakened kidneys can push you into the opposite problem. Food is the safer starting point for most people. Pumpkin seeds, spinach, almonds, black beans, whole grains, and even then, the conversation with your doctor comes first. And do not, under any circumstances, stop a prescription because of this video. Every pill on today's list is on somebody's medication list for a good reason. The goal is not fewer pills. The goal is eyes open. Dorothy is fine, by the way. Her heart rhythm settled once her magnesium was corrected, and her doctors adjusted her regimen. And she now gets her level checked as part of her routine blood work, which takes her lab exactly 0 extra minutes. That is the whole tragedy and the whole hope of this topic in one sentence. The problem took 11 years to build, and the safeguard takes one question at one appointment. Remember the arithmetic: front door and back door. A pill that narrows what comes in, a pill that widens what goes out, and a blood test that watches the checking account while the savings quietly empty. A 2024 review in Nutrients tied low magnesium status to the exact list of outcomes people over 60 fear most. And yet the fix begins with a sentence you can say out loud at your next checkup. So here is your homework this week. Open your pill organizer tonight and count how many of the 9 are in it. Write the 3 questions on an index card and put it with your insurance card. And if the count was 1 or more, make the next appointment the one where you ask. If you know someone who takes a daily heartburn pill or a daily water pill, a parent, a spouse, a neighbor from church, send them this video today, because they are the 2 most common doors this drain walks through, and the odds are high that no one has ever mentioned it to them. If this video taught you something your 15-minute appointment never had time to explain, hit the like button and subscribe to the channel, because every week I break down the medication research that affects Americans over 60 in plain English. I will see you in the next video.